that our council always treats all in our meetings with respect and courtesy, no matter the issues at hand. And with that, we very much appreciate welcoming CEO Mike Powers to speak with us this evening. Good evening, Mike.
Good evening, Greg, and board members and community members. Thank you so much for having me here. Really appreciate your time tonight. I see I've been made the presenter. Okay.
Yes, you have. You have the power.
Oh, look at that. And there it is. So I just cancel that, or what would you, does it matter?
Accept it, and then you'll be able to put it on your screen.
Share or cancel?
I'm sorry?
I'm sorry. It says share or cancel.
Share.
Okay. Yep.
And then people should be able to see your presentation or blow it up to be able to see
Oh,
it.
I don't have a presentation.
Okay, no problem, no problem. I just know you maybe had something to display.
Okay, now my screen just went small after I hit share.
Okay, so let's minimize this.
Well, it looks good on this end, Mike.
Okay. Maybe Veronica, you can put the people back up there because I can't see anything. Okay. Okay. Well, and thank you, Dan, and everybody for the invite tonight, and appreciate all that our community is doing, because it's, county governments working on this, but community members, community groups like yourselves, our businesses, our chambers, everybody's pitching in. And, I think that's really helped us for so many months keep our numbers so low, some of the best in the state in terms of our positivity rates and our the spread in our community. It's been very good, but of course we've seen in the last few weeks those numbers rise, and I think that's been startling to all of us. There we go. I think that's been startling to all of us, but we understood this was a possibility, and I think what this shows, it's kind of a wake-up call. It can happen anywhere. If it can happen in a community that was doing so well like ours, it can happen anywhere. And so the preparation that we've engaged in, I think has really has come into play. We had a press conference yesterday. I think many of you may have seen it at VCMC. But as I said, where they're full. I said to one of the nurses, "It's getting full." I said, "No, it's full." But they also said it with a smile, because they have a lot of positive energy, and they're super passionate about what they do, and they're prepared. That's the other thing, is that they're prepared. And so they have great spirit, but I could have been in any of the great 8 hospitals in our county. And so, because the same thing is happening everywhere. One of the things we wanted to do, a couple of key areas of preparation, was to develop surge plans with all the hospitals and make sure they had enough capacity. They all canceled their elective services and really did a lot of preparation with PPE, gowns, masks, and gloves, and all of that. It is one of the things the nurse wanted people to know is it is safe. It is incredibly safe, and the quality of the care has never been higher in all these hospitals. And also in terms of having surge capacity, we're fortunate in our county, and I think the city of Ventura is especially important to have both VCMC and CMH there with 2 brand new hospitals, which is wonderful, but it also means they have additional capacity in their older facilities that are right next door. So VCMC just started expanding into some of their areas yesterday, in fact. I think CMH is doing the same. So that gives us really good capacity there. But I am pleased to report that the numbers have actually started to go down a bit, knock wood, in a couple of ways. That the hospitalization number that had been 15 to 20 for so long, then bumped up to 40, and then 60 and 80 and 88. It just took your breath away. How quickly? That's the danger. These numbers don't go up in like a gradual linear manner. They go up exponentially, and that's the danger of an outbreak like this. But thanks to the good work of the community and everybody, the number has started to tick back down. And I think today we reported it was down to 74 from a high of 88, then 80, then 79, 74. So that's positive, and our positivity rate, so to speak, has also dipped a bit. So we've come off one monitoring aspect from the state and still working to come off another. So, so I say we're sort of holding steady, and the trend is pretty good. But again, it's just one of those wake-up calls again to remember, wearing the masks, physically distancing, no gatherings. All those things are never more important than now, and they really do make a difference, and we can see it in the numbers. Testing has been a big priority for us in terms of capacity. Gosh, it just seems like 2 or 3 months ago we were testing around 1,600 a week. Our goal was to get to 4,000. Well, we got to 4,000, and a week before we tested over 12,000 people in our county, and we're well above the state requirement. And so that's good. We have 13 different sites throughout the county, located geographically throughout the county, no cost and no appointment necessary. And so that's very positive. Most people can get to one of those sites within 15 minutes in our county. Now we're seeing longer wait lines lately, with some like 3 hours in some areas, and we know that's because the demand has gone up so much, and they're trying to continue to expand that capacity, but also expanding staff in order to get the test results back more quickly. It's gotten up to 6, 7, 8 days, and they're trying to get it to the 4 days. And just today, in fact, they started an automated electronic program where they're going to get the results back even more quickly. So like in the 2 to 4 day range. And so another thing that we found is that I think because so many counties are seeing this surge in demand for testing, that these lines are going up. And I think many of you may have seen LA. They actually stopped doing open testing, and they're only doing it by appointments now. And in Santa Barbara, I think it's the same thing. And so they're experiencing big surges in demand, which is affecting their access to testing. And we have been seeing about a 20% of the tests that were being provided were to people from outside our county. And so yesterday we started screening folks so that we preserve the test for those in our community, people who live or work here in our county. And so we think that will help improve the wait times as well. In terms of contact tracing, just wanted to let you know too that until there's a vaccine, the best things we can do is the testing and the tracing and the voluntary quarantining. And the tracing capacity, I think maybe some of us see on the news. I know I've seen other states like in Texas and Florida where they've had real shortage in this capacity, and it's having a big impact on the ability to contain the spread. But here in our county, we built a team of up to 140 or so contact tracers. Some, the base of the group is their communicable disease team, our nurses who are wonderful, but we've expanded that with disaster service workers at the county. So we have a trained team of up to 140 that we need. But right now we're only using about a third of that capacity. So we have plenty of additional capacity there to follow up on any positive tests. And they're getting really good response from the community, and they're pretty much caught up on their tracing. So which is very, very positive. And as we go forward, our new normal is these outbreaks and the focused follow-up. We saw it with the Calavo packing house. They had a positive about 45 folks, but to their credit, they let us know, and public health went out there with their mobile team, with the communicable disease team, and testing and tracing, and everybody cooperated and sort of was able to stop it in its tracks. And then recently, of course, we had the large outbreak at the Las Brisas farm worker housing facility, and that was, for almost 190 folks. And that's, that was very jarring. But again, we appreciated folks coming forward. They told us about it, they got tested, and we were able to trace and quarantine there. And now well over 100 of them have been released from quarantine. And so those positive numbers are dropping, and people are cooperating and so forth. And one of the things we want people to know too is we really we need to work to destigmatize it. We understand why people would be, afraid or embarrassed and whatnot, but anybody can get this virus, and it, so much of it is spread by people who don't have any symptoms. So it's just out there, and so it's not a problem. As soon as if you get tested, you can help save other people, protect other people, and so that's a message we want to continue to get out. We've been working very closely from the beginning on our vulnerable populations, like our seniors in long-term care facilities. And again, when we've had outbreaks there, focused testing team, the response team from public health and emergency medical services goes out and tests all the residents and all the staff. And I think, again, that helps to contain it because we know that's such an important part, quite a vulnerable area for outbreaks. Our homeless population, of course, is another one of those vulnerable areas, and we've seen spread in so many other areas in the last few years in other Southern California counties of other communicable diseases. And we just knew from the get-go, and the governor made this a priority. We had Project Room Key. We had to house the medically fragile and 65 and over homeless. And we did that right away. We got 4 hotels, and we had over 400. I think that at the high point, we had like 450 medically fragile homeless people housed at one time with round-the-clock medical care, mental health care, food, and case management, and so forth. So because those leases have come to an end, we've had to transition a lot of those folks. But we're very pleased that we have been able to just approved a voucher program with several of those hotels, so that we won't have that formal program on site there like EMS and OES had. We still will have vouchers for about 130 folks, and others are transitioning back to shelters and other placements and so forth. And very importantly, we want people to know, so even the voucher, whether they have voucher programs or otherwise, the services for the homeless are going to continue to be provided. It's case management for human services. It's the whole person care program from the healthcare agency, and as well as community-based, field-based mental health programming. So that's moving forward and in ongoing efforts. In terms of farm workers too, we also want folks to know that we've provided a lot of outreach to them, engagement in English, Spanish, but also in their native indigenous language like Mixteco, Zapoteco, and Purépecha. Some of those languages are not written, so we've done it in videos. We also have our, I think, first in the state or maybe the nation farm worker resource program, where we have 3 trilingual employees, several of whom who have ag experience themselves, who go out and engage with the farm workers and their families. And on top of that, we have a program called Backpack Medicine. That's doctors from the healthcare agency who actually go out and work with meet with the farm workers in the fields to give them information. And so just a really concerted effort on our vulnerable populations. Excuse me one moment. And I've just got a note, people watching. I'm sorry, what I don't understand what you're talking about. Okay, thank you. Was I blocked?
You were not
Okay. Anyway, sorry. Hello, everyone. Sorry, I'm back. I just wanted to let you know that just today I just got a note. There were 705 people tested in the city of Ventura alone today. So a lot of testing going on throughout our community. And Hi, Council Member Weir, good to see you there. In any event, so that's a lot of the effort in terms of our COVID response, and just continuing to message and really use this increase in numbers as a wake-up call to our community, that this could happen, that this is happening in our community, and but the work that each person is doing is making a difference. That they're helping themselves, they're helping their families, and they're helping vulnerable people in our community. We've also worked, this is a health crisis and an economic crisis, and we've seen, 88,000 at least or more filings for unemployment insurance. We've seen just, tremendous devastating impacts on our local businesses and layoffs and so forth. So one of the things that we've worked to do is really try to support our local business, and some of the best things we can do is keep our numbers low, and so that enabled us to move quickly to the state's phases of reopening and get the accelerated attestation approved by the state very, very quickly, and allowed the retail and restaurants and so forth to open. Of course, now we're in a place where the governor is pulling back on some of that because of the numbers. But again, I want to just stop and talk about the business community for a minute too, because from the get-go, we've worked really closely on all of this. Actually, let me step back even further with our community partners. We started regular calls with our city managers. We have at least 3 calls a week, if not more, with the city managers, with our business leaders, with our chambers, with the Economic Development Collaborative and our nonprofits, community-based organizations, our educational systems, as well as our homeless providers. And so we've continually tried to really coordinate with them. But in particularly with the businesses, we've been engaged with our chambers and EDC, try to hear their concerns, and getting their feedback was really helpful as we were working with Dr. Levin to sort of assure him that the business could reopen it safely. And before the state had guidance, some of these businesses came up with amazing guidance, whether it was in real estate or car dealerships, about how they could do things safely. And now the state's come down with a lot of their industry guidance, and that's helped move things along faster. But that hasn't changed the fact that from the get-go in our county, what we found is that our businesses have come to this with a spirit of wanting to comply, not just with the letter, but with the spirit of the law. And it's extraordinary because they care about their employees and their customers, and they're so dedicated. And two points I want to make about this: we're unique in Ventura County in that we have this business ambassador program. So we require folks to register businesses to reopen, and even if you were open as an essential business, you need to register to make sure that we've got your physical distancing policies on file. But we also work with the cities and our county RMA department to develop a business ambassador program to go out in a positive way, a consultative way to each business, just to see, to check in. Are you, have you implemented your policies? Do we have some best practices? Do you have any questions? Can we help? And the compliance was just really through the roof. I think we had like 5 or 10% that needed to be re-inspected, but not very many. And that's been, we really reinforced that with Dr. Levin, that I don't think many counties have this, and they don't have the level of business compliance that we do. So fast forward to now, why does this matter? As the state, you see the governor, he wants to see enforcement in a couple of ways. One, he wants to see counties adopt the state's order in their local order, and we've done that. We're on the good list, not the naughty list, as some counties are. But the other thing is he sent down strike teams of enforcement folks to see, are we actually doing what we say we're doing? And I just got this information, so I'm just, it's new to, I don't think many people have heard this. We'll be releasing this soon, but the ABC state teams were down here and they visited about 375 sites here in about 5 days. How they did that, I don't know, but it's just amazing. And if you told me that our compliance rate was above 90, 95%, I would have been amazed, right? I would have been just blown away. But it's actually about 99%. I just want to let that land there for a minute. And I was sharing this with Dr. Levin this afternoon and Rico too, because you feel it, it's good, they're going to be compliant, but when you see that kind of result, I think the state was very impressed, as they should have been, with our community and with our local businesses and our cities and our chambers. So it speaks to that collective effort. So we'll be releasing more information and news releases on that, and proud to do so. But that is going to help our community and our economy as well. So some of the other things that we've done is in partnership with the cities and the chambers and our community partners is develop a business assistance program, as you know, with CARES funding. That's the federal CARES Act funding. And we put set aside $10 million for that and $10 million for a rental assistance program for low-income folks. And so I'll start with the business program, and that deadline just closed yesterday. And they're still tabulating the numbers. They had a big push the last day. So I think they had roughly 5,000 businesses apply. So, which is great. We did a lot of outreach effort. Big credit to the Ventura County Community Foundation, Vanessa Bechtel and her team, the EDC, Economic Development Collaborative, and Women's Economic Venture, who, because they had their rapid relief fund, they had a lot of capacity in place. They were able to jump on this and do this. They've done an amazing job in partnering with those businesses, because a lot of them didn't have business licenses, and we need them to have their business license, and we're partnering with the cities to make sure they get those. So right now, that exceeds, of course, what we had allocated for. There are $5,000 grants, so that would allow in 2 phases, for the first 1,000 businesses, and then another 1,000 businesses. And of course, we're focused on, also there's some priority for minority and women-owned businesses. And so, but that total would be about 2,000, but we are talking to our board. We have additional funds, so we are going to allocate additional funds to this program. And we're not sure the exact amount yet, but it helps to know the amount. We weren't sure how many businesses were going to apply, frankly. We had heard maybe it was going to be as many as 15 or 20,000, and that would have been a challenge to try to cover. But so we know it's 5,000, and that's a lot, and we know businesses are hurting, and so we'll be working with them to increase the amounts and process those applications so we can get the funds to those businesses as quickly as possible. On the rental assistance program, that deadline closed about a week ago, and I think we had about 2,640 folks apply for that, and right now it's up to 2 months rent. But again, we'll be able to allocate some more federal CARES money to that program. So we'll be able to, we're looking at possibly, say, standing instead of 2 months, maybe 3 months rent, that kind of thing. So we just want to get as much money as much of this CARES money out in the community as we can. Let's see other areas I want to touch on here, and I can also stop. I know I've sort of thrown a lot at you there, and I'm happy to pause and take some questions on that. There's obviously a lot going on there, and I do want to talk about some social justice issues as well. And I know I've got some other written questions that you've sent, and I'm ready to respond to those. But just before I go any further, Greg or Dan, any particular question?
I'll kick it to Dan. Dan, you're handling the questions. The best bet for folks is to put it into the chat line, and then Mike, you'll be able to see them, or we can read them to you, whichever way you want to do. And the chat for everybody is in the upper right corner. It's kind of that bubble up in the upper right corner.
It's in the corner right next to the number of people that are watching right now. So you just click on that, and then you can type in your chat question. Mike, I'll go ahead and ask the questions we had from our board members.
Okay.
So the first one, do cities and counties need federal money to cover the toll from COVID-19? And do you expect to receive any federal dollars?
Yes. A big yes. Both cities and counties. And we have received some, and so let me walk you through that. So I'll say there's sort of three main buckets of CARES funding. One went to hospitals, not just the county hospital, but private hospitals as well. And I think what the federal government recognizes is that when you're asking hospitals to create surge capacity by canceling elective surgeries, that hurts their revenue, and they need that revenue in order to continue to operate. So hospitals have been receiving those funding, and our transportation system has also received some significant, it's called CARES Act, that's federal funding. And they can use it for lost revenues as well too. The county, we did receive a sizable check of about 147 million in CARES funding, but unfortunately the money given to counties was limited just for direct expenses related to COVID response. It can't be used for lost revenues because we see the big hole in the state budget, and that's going to affect core services like social safety and health services. Right now, we can't get that funding in, but there is active discussion in DC legislation where it's proposing to give that flexibility to use for lost revenue, just like for healthcare and transportation. And so that would be extremely helpful. I know the county and the cities are going to get some more funding, CARES funding through the state, and those allocations are coming out for COVID-related response expenses. We are using it, as you can imagine, for the extensive testing, cost of testing, Project Room Key, the PPE, enforcement efforts, healthcare response, all of those things, and Great Plates. We've done a lot of feeding seniors. I just quoted yesterday, over 1 million meals served. That sounds like it's a made-up number. It's not. Over 1 million meals served to vulnerable seniors in our community. Over 16,000 different seniors have been fed through this program, and that's a combination of Area Agency on Aging, HSA, Food Share, really partnering well to do that. But those are wonderful programs, but also, for contact tracing, that requires some significant funding as well.
Thank you, Mike. I have to say, I'm just amazed with all the information you're providing us this evening. I'm glad we're recording this so I can go back and listen to it. Second question, with the arrest of 2 county employees, now former, for the destruction of Black Lives Matters poster in Thousand Oaks, what efforts is the county doing to stamp out discrimination and racism in its ranks?
Yeah, I really appreciate that question, and I'd say it really was also that was a horribly unacceptable incident, but also after the killing of George Floyd, that really obviously had a huge impact on our community and on our county government, our county community. And so we did a couple things there. One of the things that we started about 5 years ago in the county was a thing called a Diversity and Inclusion Task Force. And we did it because we didn't want to do it because there was a particular problem or anything, or that we're responding to something. We just, with 9,000 employees, how do I know, how does the board know that we're really being proactive and making sure we're not just looking to see, oh, we don't have too many race discrimination cases, that's good, but are we truly embracing diversity in our workforce and in our culture here? And so the best studies, Harvard and everybody says, it's not, top down doesn't work. It's not like I'm going to tell people you need to be, go to training and really accept this. And people don't like to be told what to do. It has to become, forgive me for using this term sort of more organically. And so what they say is get a group of employees and managers and so forth, and a diverse group, and then have them identify the issues and tell you as leadership what you think, what they think you ought to be doing. And so we had that group in place already. And so we convened that group, and we did a couple things. One of the first things we did, well, I sent out a letter to the staff, and I think I sent out to the community too, just talking about the fact that the first thing that we need to do is listen, and really listen in different ways. And for me personally, it's personal for all of us, right? Civil rights is something that's deep in my heart, and it's very important to me, and I feel like I listen really well, but I realize I hadn't been listening enough and as openly, and so I think we all just needed to do that. And so we had community town halls with our employees on 2 different days, and we had a really good panel of folks who spoke from the heart, and I think set the table that we could be open and we could have difficult conversations and talk about things that might be hard to talk about and make ourselves vulnerable. And just a credit to them, people like our behavioral health director, Dr. Savette Johnson, Marcus Mitchell, our child support services director, our assistant public defender, Claudia Bautista, and Monique Nolan from Area Agency on Aging. They just did a beautiful job, and our employees, to their credit, they stepped up. We had 900 employees participate in these forums, and we got great feedback and great ideas from them. And so from that, we're developing a strategic plan to work on our culture here in the county in a number of ways, and in terms of meaningful training, like implicit bias training. We also provided, we started last year, I believe, we require all 9,000 employees to undergo diversity and inclusion training. And so now we're going to add implicit bias training and examining all of our policies to see if they really do reflect diversity and inclusion in our county. And also, we are in the process of setting up a community forum with our board and with some community leaders and with our law enforcement leaders, like our sheriff, Bill Ayub. And I want to say, you heard the sheriff come out and condemn those actions, and as I did as well, and as our board did, because there's just no place for that. There is no place for that kind of behavior in our workforce, in our county, in our community. And we just need to be really just forthright and straight up about it. We also partnered with the NAACP, Regina Hatcher Crawford. They held a rally out here at the government center grounds. I think it was well attended, good social distancing and mask wearing, but just really heartfelt. And we want people to know it's okay to have these discussions. And the other thing that we're working on is our hiring practices. So we look to see what our workforce is it reflective of the diversity of our community, and in general it is. It's really pretty darn good. But we also noticed in the numbers that as you get into the management levels, it's not as reflective. And so the Diversity Inclusion Task Force recommended that we start a mentorship program. And so we've done that. And we're actually we finished our 3rd cohort. We're starting our 4th cohort. And I think that's been very effective. The other thing that we do is we do a lot of advertising throughout our county in different newspapers, Spanish language newspapers as well. And we have, even for our at-will positions, now at-will positions, these are the top leadership positions in all the departments. They don't have to do recruitments, you can just appoint people, but we decided about 8 years ago to say, no, we should have a process for that. That's not right. And so we do pretty much almost open national recruitments for all of those leadership positions, and we have diverse panels. And so the result of that, we think, has been super qualified people and a diverse leadership group in these managements. In the last couple of years, we've seen much more reflective of our community. But this is a pivotal time in our community. I watched the City of Oxnard's panel last night, and great discussions there with their community and with their council. And so we look forward to having a similar discussion here. But this is just the beginning, you know, and it can't just be about talk. It has to be about action as well. And we have to have measurable improvement. And I think with our diversity inclusion task force, the other thing we're doing is we're expanding the committee membership. We have representative from the sheriff's there, but now we're gonna have a sworn member there, representative from the DA's office as well. And just, it's really great because they give us really good, straight feedback on what we need to do to not just, what we need to do to truly embrace diversity, and because that's a strength. It'll be a strength for our county, and it's who we are as a community. That's one of the things that makes us special. So.
Thank you for that very good answer. A lot of information there as well. That's amazing. You kind of ahead of the curve on all of this stuff. Third question: Does the county track arrests by racial and ethnic groups, and if so, how are any groups disproportionately represented?
Yes, thank you, Greg. So we do, and these are numbers. I just got them this afternoon. These are booking numbers from the sheriff, and so it's not necessarily from the sheriff's jurisdiction or the city's jurisdiction. It's county-wide, and we do see some disproportionate in the areas of Hispanic, Latino. It looks like it's about 54%, and our community is probably roughly 42 to 45%. In the African American, it's about 5.9%, and our community is probably more in the 1 to 2%. So we do see some of that there. Sheriff did point out that some folks, though, sometimes there's people who come in from other counties, from LA in particular, and when they're booked into our jail, that gets counted, but that might not be reflective of our community. So.
Thank you. In 2018, Ventura County put on a seminar called "Designing a Healthier Community" by Richard Jackson in regards to our built environment. Could you give us an update for this health policy and the general plan?
Yes, I can. I'm struggling to find my exact notes on that at the moment. I apologize. Oh, here it is. There's a lot of information on that one. Oh, yeah, here we go. So basically, yeah, we have, as you know, we're undergoing a new general plan, and so public health has worked on that as part of that plan, and so they have included many different elements in it, and I can share this information with you, and so it's got multiple different areas. And I'll just give you some examples, like limiting the concentration of unhealthy food providers, particularly in our low-income areas. You know, sometimes they don't have access to as healthy a food as we want them to. Connections to local produce, support for certified farmers markets and community-supported agriculture, value-added alternative waste disposal, more and more organic and composting efforts now, in food waste composting efforts coming online, and co-location. You know, the built community, wanting to have more folks located, so the more walkable communities. I know the city of Ventura is doing a great job of that, and downtown. And just let me back up too. That makes me think of, I just want to commend the city too, and the chamber and all the restaurants there for those outdoor areas. It just looks great. I see restaurants and people being able to go out to restaurants in those beautiful outdoor facilities in downtown Ventura. So anyway, I know there's a lot of good things going on there, but and we also adopted a health in all policies framework, and actually in 2015. And so those are just some of the elements, and I'll send that to you, Dan and Greg, so you can share it with your members.
Thank you. And then the last one I have from the board is, do you see any relief on the horizon for renters when the moratorium on evictions runs out, and they still owe a huge amount of back rent that landlords would need to be reimbursed for. And I'm not sure how that, if the county is looking to do more or not. But just wanted to.
Yeah. Thank you, Dan. So this ties right into the rental assistance program that we set up. And so recognizing that, that the deferral of the eviction is helpful, but it doesn't solve the problem. And so that's why it's tiered grants. It's $1,500 for studios and 1 bedrooms and $2,500 for 2 bedroom or larger. That's up to 2 months rent for folks. And it's, again, 2,645 people applied. So that will help. And again, we're going to increase that. I mean, I can't say that formally. We'll bring it to the board, but I know the board is going to be very supportive of this. We've got additional funds to do it. So that will help that as well. And just to let you know, one of the reasons we were able to do this program so quickly is because we had the existing capacity in our human services agency. They have a homeless prevention rapid rehousing program. And that's basically, it's a rental assistance program for people who have recently been evicted or received an eviction notice, or they feel like they're about to, lose their apartment. And so that's up to 6 months of rent and utilities assistance. And the county and many of the cities dedicate their CDBG funds, and the county puts in some of that, some general funds as well for that program. And so we have that staff already, and so they're able to administer this new program, but this other HPRP program is ongoing. And it's really effective because, I thought for folks it might be just a Band-Aid, but like 80 to 90% of these folks who are on this program, this HPRP, stay housed 1 year later. And so it's really these, if you can get people through these tough times, they really rally and get stabilized. So.
Well, thank you for that. That was my question, because and I'm glad you answered it the way you did, because once someone becomes homeless, it costs a lot more money to get them back into housing. So I'm very glad to hear that.
Yeah, it really does. And, of course, something happens, once they become homeless, it's kind of a spiral, and they lose hope and confidence. And so if we can hang on to them there and support them when their greatest time of vulnerability, it makes a big difference. And, in that regard, too, I just want to step back and say we really appreciate the partnership with the city of Ventura to open the first in the history of the county permanent year-round homeless shelter.
Yay.
At the Arch at our Knoll building. And we appreciate that partnership, and having Mercy House there run it. It's worked really well. It's helped a great deal during this challenging time. We also have a partnership with Oxnard and their year-round shelter as well, and looking for a permanent location there with them. But the Arch, it's one of those things you talk about, but to actually do it was pretty amazing, and we appreciate the community and the city's support in that.
Yes, very much so. So I have one question on the chat line. So if anybody else has some questions they'd like to ask CEO Mike Powers, now would be the time to type it in. The first question I have, with regard to the percentage of out-of-county persons testing in county, are those positive cases included in our numbers? Also, with regard to antibody testing, are those numbers included in current COVID positive numbers?
Yeah, great question, Crystal. Yeah, I asked that question myself, and the answer is no, they are not. And they're not included in the antibody testing are not included either.
I don't.
Thinking about Crystal, I just want to make sure think of the fire department too. Back on diversity, I really want to commend our county fire department, because they have gone along, just made huge strides in their recruitment effort. Because for about 40 or 50 spaces, they can get 2,000 to 3,000 applicants, and to really truly make it fair and objective, they make it they limit it down to qualified folks to do a lot of background and checks to try to get, and they got it down this last time to like 1,000 people, over 1,000 people who were eligible, and then we did over 1,000 interviews for those slots, and that took the fire department, our office, many people chiming in for about 3 or 4 weeks to do that, and then they made it more objective and random, and I think it's reflective in the workforce, and we had a lot more women in this last class than I think we've ever had in our history. So hats off to them.
Great to hear. I'm not seeing any more chat questions, so if anybody has a question, now would be the time. Going once.
I'd give it a
Right,
couple
fast.
minutes. I'd give it a couple minutes, Dan. We have a couple callers or people that have called in, so they obviously don't have the option to it. So if you just called in, you want to ask a question, unmute yourself and let us know. Well, Mike, I think you answered it all.
I doubt that.
Well,
I think
okay,
I
so
just wore 'em out.
I'll keep them going here a little bit. Like, just a question for
Okay.
when do you feel like revenues? I really feel for your cities, counties, and state. When everybody told us that this fiscal year is probably okay, but the next year is going to be the one. When do you think that tsunami that's going to come in as far as just loss of revenue between sales tax and everything else?
I think we're already seeing it. In cities in particular, I really feel for our city partners. The county doesn't depend as much on it. We do because our realignment money comes that way, but the cities it's already happening. I think, the governor came out with his $54 billion projected deficit and, understandably being very conservative. I think it's probably not going to be that bad, and the numbers are looking a little bit better. We've seen the economy improve a little bit with some of the reopening and some of the Fed support there. But, we're already seeing it. And I really appreciate that question, though, too, because we provide a lot of core services, just like as the cities do. And so it's so important that we're able to protect these core services of safety, health services, and social services. And so, just want to let you know at the county level, we do have good reserves that will help us get us through, and we're very pleased. We just went and refinanced our hospital bonds and saved some good money there, but we kept our AAA rating for both Moody's and Standard & Poor's, partly because we had those reserves. But we're going to make sure that one way or another we sustain those critical core services for the community, because that's why we're here, and that's one of the reasons we built those reserves, is so that when people need it the most, we're not we don't lose those. But at the same time, we are advocating at the federal level to get that flexibility, and if we get that flexibility, I think that will help the counties and the city. Even if they get more money, that's great too. We'll be happy to get that. But even if they just said, we'll give you the flexibility to use it for lost revenues like healthcare and transportation, that would make a tremendous difference. But I think we're stronger here, not because of our community. And I want to thank our taxpayers too. Our property tax collections stayed incredibly strong, and that's each member of the community, paying their property taxes at a time when I'm sure it's never harder to do than now. And our collection rate was really strong, and so that allows us to keep providing these core services.
I do have a couple of comments. Both Stephanie Caldwell and Karen Flock wanted to just say thank you for being here, Mike.
Oh,
And I do see a neighbor of mine has his mic on, Steve Chalkins. Steve, do you have a question? Come on, you're a reporter. Retired? Steve? Put him on the spot. Well, I'm not hearing anything, so I guess he's quiet for now.
All right.
All right, well, I don't have any more questions, so unless there's somebody else, Christy Weir, do you have something you'd like to say? Unmute yourself and try. There you go.
There you go.
Thank you, Mike. You have a really hard job navigating the ups and downs, never knowing from day to day. So we appreciate everything you're doing. And Dr. Levin, I think the community has come to trust your information and your actions, and the city is relying obviously on your health initiatives and your health orders. So we really appreciate everything you're doing.
Well, thank you so much, Councilman. That means a lot. I'll share that with the team. It'll mean a lot to them.
Yeah, it's we're in a hard spot right now, and I think people are a little worried and a little scared, but knowing that you guys are figuring out what we need to do is helping. So
thank you. Well, and we appreciate staying engaged with our partnership with the cities, and the city of Ventura, I don't think has ever been stronger than right now, and it's really helping. Yeah, thank you.
All right, well, I guess we will just thank you so much. Really, I do appreciate all that you've brought tonight for us, all that information, and we really do. I feel very proud and happy, and I know we all do, of the job that the county, all of you are doing there, and at least we have some strong local leadership that we can rely on, and the city as well, and the state. We'll stop there. Anyhow, all right. Well, thank you very much, Mr. Powers. We really appreciate it.
Thank you so much, Dan, everybody, Greg, all the board members, all the community members, council member. Thank you very much. Take care.
Thank you.
My friend.
Good night. And now we'll go ahead and move on to Joe. Where is he at? He's here somewhere, and I think Greg's gonna transfer power to you. There he is.
Hey, Joe. You should be presenter.
Let's see if you can see this.
There.
Yes, we can. Yep.
Great. All right. Well, thanks, Dan. Thanks, Greg. It's a hard act to follow, Mr. Powers, but I'll do my best.
Joe, could you, I don't know, not sure if I got your name right. Could you tell me again what that was, what it is?
Yeah, sure. It's, oops, sorry. It's Oftelie.
Oftelie. Thank you.
There you go. No problem. Oop, trying to fix this. There we go. Okay, so want to thank you again for having me here. Wanted to talk a little bit about our proposed project that we're calling Haley Point. Warmington Residential was here about a year ago when we first got under contract to purchase this property, and I think we gave a lot of information about who Warmington is. So I won't bore you with that again. I'll just get kind of into the good stuff here. So the project we're talking about, and I'll get to an aerial view here shortly, is at the corner of Seaward and Channel. So this is a picture over here looking down seaward towards the ocean, and this channel along this edge. Are you guys seeing the next slide?
No.
No, we're not.
Not yet.
No.
Yeah, we see the opening one.
The opening one, yeah. I've switched to the next one. Let's see. It's kind of delayed.
There we go. Thanks.
It's just a little delayed, so I'll keep talking and slide a little quicker. So that is the looking down seaward on Channel and some of the existing kind of light industrial uses that are on the site. The property is 2400 Channel Drive. Trying to see, it's still not. That's a little less than 4.5 acres. Right now, it's zoned for neighborhood, medium, residential, which allows for between 9 and 20 units per acre. So here's that. Oops, sliding down. The zoning is M1. So the next slide I'm going to show you, and hopefully it pops up here, is an aerial view. For those familiar, the site's bound by the railroad tracks, generally to the south, Channel Drive along generally the north, seaward to the east, and some light industrial, to the west, light industrial to the east. There's a variety of industrial uses, storage, other things on site right now. So we're in this residential area of 9 to 20 units. So the next slide is the general plan, which shows that. I'm going to see if it moves a little bit faster. Let me show the zoning map. I can see what you guys are seeing in the corner, but it's not moving anywhere near as fast as I'm sliding it. Long story short is this year in end of May, we submitted a pre-application to the city for their development advisory committee to review and provide comments on what we were proposing. So we should be getting comments here any day. It's been a little over 30 days since we submitted that. So we are still not moving. But,
Joe, I think your Wi-Fi in your garage isn't as strong as it should be. You're a little blurry still, and that's probably why it's not moving. I'm no techno wizard, but that's my guess.
I wonder if I can turn off my camera, if that would help. You don't get to see my face, but maybe it'll be better.
Dan, you're very right.
So I have moved on to, and you're right, it's moving a little bit faster. Here we go. So I'm going to show you guys what our proposed site plan looks like in the next slide. It's it's moving a lot faster. There we go. So we're proposing 72 homes over the 4.5 or so acres. Everything you see along here, can you guys see my mouse? Probably not, it's blurry. But along Channel Drive, everything is 2-story, except for a couple units down at the far east side along Seaward. Those two, there are 3-story. Mostly 2-story along the interior drive with some 3-story units along the train tracks. So we have one entry off of Channel Drive, kind of a main drive that'll be landscaped and kind of enhanced pavement along that edge. There is a secondary exit off of Seaward for the neighborhood to come in and out of in that location. And we're still proposing parking all along Channel Drive. So there's about 28 stalls along Channel Drive. There's another 21 guest spaces kind of scattered throughout the site. Some of them are harder to see, but there's spaces kind of at the end of each one of these alleys along the railroad tracks. Let's see, what else do we got? There we go. So open space, we have a general open space as you come into the community here, central courtyard, and then we have kind of some pocket parks on the east and the west side. Of these 72 homes, 20% of them will be set aside for below market rate at the moderate level. Let's see. Next up, I'm going to show you kind of what a typical elevation will look like along Channel. There you go. And you can kind of see the 3-story element behind in the distance. And then I'll put it back on the site plan. I think that's probably where most people are interested and want to see. The 2-story units will be about 30 feet. The max building height for the 3-story will be about 36 feet. We've got 20-foot setbacks on most sides except for the front along Channel Drive. That'll all be landscape, street trees, enhanced along that edge. A lot of screening trees along the eastern edge with our neighbors being industrial, light industrial manufacturing types over there. Every home will have a 2-car, side-by-side garage, attached garage. There will be a pretty large wall. I think we're talking 8 feet or 9 feet along. Let's see, I don't know if we called out the height yet, along the tracks, and then along the eastern edge as well, to prevent some of the sound and the noise that we're getting from that use. So the site is about 16 units per acre. So we're not going to the max 20, but we're also not at the minimum of 9. So we're somewhere in between. We weren't trying to pack them in here. We're trying to provide the best product for the site and kind of address all the different edges that we have that we're dealing with. So I think that's the majority of what we are proposing. We are waiting to get back comments from staff. We're waiting to hear what kind of comments and feedback we get out of this meeting. And once we get that, then we'll be trying to address as many of those as we put in for a complete entitlement application here in the coming weeks. So I know we had a few questions. I don't know if I can see what.
I can read you the Joe, I can read you the questions. I know that Bill McReynolds and Nancy Johns from your team are also present here somewhere in the little dots. So I don't know if they want to chime in on it with anything as well. But I'll go ahead and ask our questions. First question, describe the project's affordability and how it will be restricted.
So like I mentioned, 20% of the homes, which I think is 14 of the units, will be at below market rate. Those will be deed restricted, so they'll stay with the land. They'll be at a moderate level, so that's 80% of the median income. It's a function of that gets us to the price that we'll be able to sell those, and they will be restricted at that price.
And kind of another question, but it kind of goes along with that, so I'm going to ask it with this. Did you consider doing low and very low affordable units, which are so far behind to meet our RENA numbers? Moderate helps very little with our housing stock, but market rate is only slightly higher and people don't want the added restrictions. So was there a discussion about doing very low and low, or just went straight to moderate?
You know, for sale housing, moderate is really the most effective way of getting, you know, those types of units to meet your housing and RHNA requirements. I mean, every city in the state is behind on their RHNA numbers, so anything that is going to be adding to the housing stock is going to be a help. And I think if you're going to be trying to go after the low and the very low, I think apartment use, rental use is probably the biggest bang for your buck. So what our approach was is to meet the code, meet the ordinance that's established at this point, which allows us to do the moderate. It's a higher percentage. We're at 20% of our units versus some of the others, but it made sense for us from a for sale perspective. The second part of the question about being not much different, I think it is significantly different in terms of sales price from what a market rate unit versus a below market rate unit will be here. We're talking more than 6 figures. So yeah, there's a gap there that I think the people that are trying to qualify and they have easier ways to qualify for mortgages on the below market rate units, it's still a benefit for the entire community.
Okay, thank you. How is this new complex on Channel Drive supposed to be supported by water and infrastructure when we are still in drought conditions?
Yeah, there's been drought conditions, you know, on and off forever, but it hasn't restricted development in the state and the need for housing up and down the state. We're paying a significant water impact fee to help address the impacts that our project will have on the water demand. I think it's, I have to look at what the number is. I want to say it's $500,000 or $800,000 or something along those lines that we're going to be paying in fees for water by itself. So I think we're in a spot where we're going to have adequate water. We'll be paying whatever upgrades are needed to get us the adequate water, but we don't see that being a problem at all. In addition, all new homes are much more water efficient. I think from the houses probably across the street, we're going to be 50% less water usage and demand from what they're doing. We don't have lawns. We have all low flow water fixtures. There's a lot of things that make our new homes a lot more efficient than what's existing. So the housing stock that we're providing here, although there is a demand, it's going to be a lot more efficient.
Okay, and the last written question I have, how is traffic and parking going to be handled? Parking is not great in that area already. I think you kind of answered that already, but if you would like to add to that, that would be great.
Yeah, I mean, I think if you look at this plan here, you see there's 193 spaces that you know, in and around this project for the 72 homes. A lot of those, 28 of them are existing, or we're going to be maintaining along Channel Drive or kind of establishing along Channel Drive more formally. Every home will have a 2-car garage. All those garages, this is a development that will be managed by a homeowners association that restricts the usage of a garage to maintain access for 2 operable vehicles to be available to park there at all times. So you can't just load up your garage with junk like a lot of us, like I do, and park out in the driveway or on the street. So people have to use their garages for cars, and then there's adequate guest spaces for what we're doing. I mean, it could be an impacted area, but I feel like we're providing enough. We're meeting the code requirement for the required parking for our development.
And I think the 28 spaces on Channel, that's just on the side
traffic,
of the street.
We don't see this as being a very big impact. It looks like a lot of homes. It'll be a big home. What's that?
Joe, the 28 spaces, those are all on the south side of the street that you're counting the 28? Parking?
Correct. Yeah, we're not counting this up on the northern side of Channel.
And that's what it looked like, right?
Yeah, if you look at my plan,
yeah,
all these P's represent the parking stall.
Yeah, I just wanted to
And
make
then
sure.
down here,
All right, another question, and this, I have to say, I like this question, and it came up when there was a possibility of a project on the other side of the tracks. Any possibility there could be access across the train tracks?
we're not proposing that. You know, we're trying to stay out of the rail line as much as we can. That's not something that we're interested in doing. We understand what goes on there at Seaward, but it's not a problem that I think we can solve with the development of these homes.
Another question just says photovoltaics, I'm sorry.
Sure, yeah, every home will have solar panels. That's a new building requirement, so you'll see that on every year.
And I guess it's a follow-up to that. Sometimes I know when I type these chats, I hit the wrong thing and it sends. I think the rest of the question, please briefly describe any solar panels proposed residential development? I think you've answered that.
And answer. Yeah. Everyone will have a solar panel.
And what's the time frame for the townhomes to be built? Did we lose you, Jill?
You know, in the process, we have to develop our plans. We have to go to the planning commission. It's hard to say. We have to go through the entitlement process and get approval there. Can you hear me now?
Yeah. Yes.
Yeah.
Well, I
How
heard
about
you. Yeah, I can hear you.
Sorry about that. The question. Okay, good. The question was the time frame. So I think the time frame is that we have to get through the entitlement process, which is still a very, several month process. We wouldn't be going to a planning commission type hearing until possibly the end of this year or early next year. At that point, we would kick off all of our improvement drawings, which takes some time, and then get through a permit process. So we wouldn't see these going to sale until the early part, or later part of 21, early part of 2022. Is when those you start seeing these for sale.
Thank you. I do see a kind of a comment. City has never addressed the issue of the illegal railroad crossing at Seaward, directly located where one of the only two exits is located. I know we tried to work with Union Pacific several years ago and got a little bit of headway, but not much. Is there anything that you could add to that?
I mean, we'd be fully supportive and cooperative if there's anything that we can do to do that. But to try to take that on as part of what we're doing is not really in the scope of what we're trying to accomplish. I think it's like the comment says, the city's to address. But we would be open and try to help out in any way that we could.
And outdoor lighting, please briefly describe how outdoor lighting will be designed dark sky compliant fixtures? Question?
Of course, yeah, everything's going to be shielded down. Whatever we're going to be the for keeping all of our light on site. So you'd expect a lot of the lighting to come from the buildings themselves. I don't expect a lot of kind of street lights, so it would be all restricted, and you would have dark skies.
And then how will traffic be regulated as Ocean, Arcade Drive, and Evergreen are already busy streets?
I mean, I don't know that there's any restrictions other than Channel Drive is a pretty large stroke. We are proposing to narrow Channel Drive in some areas to make it less of a thoroughfare, but other than just its normal residential traffic that you're going to see in and out of Channel versus some of the maybe commercial traffic we're getting now is the only difference in terms of regulation.
And green space question? I guess how much?
Yeah, I went through that a little bit. Sure. Yeah, I mean, there's about, you see here, there's an open space summary category. So common open space, there's 30,000 square feet, it looks like. Private open space, that's going to be decks and patios. There's about 25,000 square feet. So in this area here, we call this a central courtyard. As you're coming into the area, there's this kind of large central courtyard. We haven't really over-programmed that area, like what could be in that area if there's anything specifically. And we've also kind of added these pocket parks in the corner here, a couple of them over on this side over here where we can do some programming. Those are the kind of main open space areas that we're providing.
Okay, and playground. Due to the remoteness of parks, will the proposed development include any children's play structures?
Typically not. I mean, in our experience with developments like this, those play structures are pretty specific to an age group. So you have someone, that's between, 2 and let's call it 10 years old that is able to use those. So it's only a small window of their life that they're able to use that. So our preference is to find some space that can be multi-generational, used for different ways for different people, where the majority of our residents are not going to be in that age group. And for those that are, they're not going to be in that age group very long. So we have to utilize the space that we do have to be of a more multi-generational type of use. So tot lots, playgrounds like that, those typically aren't best used for the entire community. So we don't typically include those in our developments, unless there's a driving force to do so.
Okay, another one, solid waste. Where are the trash receptacles?
Everyone will have their own trash cans in their garages, and so they'll just pull them out to the street, just like everyone else that has a single family home.
Okay. I don't know who Ion Ventura is, but they have lots of questions and good ones. Anyway, any other questions? I need to see them typed up here pretty quick. And if there's anything else you would like to add, Joe, or your other cohorts with you somewhere on those little squares. Let's see. Have you had any meetings with local residents, and are they active in your planning? And what are you doing to control traffic in the existing residential areas caused by the development?
We're not restricting any kind of parking. I mean, we've been in some instances where we've had developments where the parking is so impacted that the neighborhood that's existing has formed parking, what do they call them? I'm losing the permit parking area. So if this were going to be a problem where the homeowners that were going to be in our development were overflowing and parking in the other streets, and that were become a problem on Arcade or Evergreen or even Channel on the north side, a parking permit program could prevent that. But other than that, it's pretty rare. These people aren't necessarily going to be parking down those streets. There's plenty of parking on site, plenty of parking along Channel Drive and inside the garages. So that's not typically a problem that we see in new developments.
Garage, wasn't the HOA restricting garages to cars?
Yes.
That's a good one.
Oh, and trash. I guess that's a question. Yeah, there's trash cans in there. Yeah, we make enough room. I don't know if I can zoom in, but in the back corner, you can see there's a spot for 2 trash cans in the side. So there's room for 2 cars and 2 crashers. It's not to say that you can't have storage in your garage. You just can't restrict it from not having 2 cars being able to park in there.
Well, that's good to know, because that can be an issue real quick when we all have too much stuff. George Carlin used to say, way too much stuff. Is this the final plan? And I'll let you answer that.
I didn't answer the previous question about community engagement. So it's something that we're going to continue to do. This is, one of those things.
And I guess meetings
we
about
did it early on here with this group. We intend to have additional community outreach to go over this. There's still going to be
you will be going.
Anything?
I think we lost you there for a second, Joe.
Okay. So we're going to be doing community outreach. So that'll still continue to happen. It's not the final plan. I would say it's pretty well developed as far as the final plan, but we still need to receive from the city and from this group to see if there's any changes that we need to make sure that we're providing the best possible project for the entire community. But everything that we're showing here is all code compliant, meets all the zoning requirements, all the setbacks, height restrictions, all those things are all in the code.
And who is the planner with the city that's working with you on this?
Her name is, she's new. Let me see if I can get her last name.
We have a lot of new people up there.
Jared was working on it, and then they turned it over to Dara, and I can't remember her the last name off the top of my head, but she was just assigned to our project.
Yeah, and I'm drawing a blank. I know the last name too, but I can't think of it. I know Christy knows.
Dara, there you go.
Thank you. All right, any other questions? I'm not seeing any, so I think this was good for all of us to be able to see this. I think there's a lot of, just concern of how things work out and as you move forward. And certainly as a community council, we certainly like for you to reach out to the immediate neighborhood, as well as we appreciate you meeting with us here tonight. So I know the property owner here has been working on something there for a long, long time. and I think it would be great to get something built there in our lifetime. Anyhow, I guess that's it. Unless there's anything else that you want to add, Joe? I don't hear you, Joe. I think next time, Joe, you need to get out of that garage and go in the house and use the Wi-Fi there. All right, well, thank you very much, everybody. I think this was a great meeting on both counts, and really appreciate everybody joining us this evening. And I know Greg Mansfield will be, he has recorded this, and he'll get it on our website fairly soon. If you wanted to recapture anything, and I have to say, with all the information that Mr. Powers had, I need to kind of hear that again to digest some of it, but it sounded great to me. And appreciate you being here as well, Joe. All right, with that.
Thanks, everybody. Stay safe, wear your mask.
John gets the last word. Thank you very much, everyone. Good night.
Thanks, everybody. See ya.
Bye, Christy.